Here we go. Do patients get to choose the kind of anaesthesia they receive?
That's a great question.
That's interesting because I've just done a video that's coming out soon about what is informed consent in Australia. So the process, I think, should be that, you know, we assess a patient. We're kind of assessing them for the risks of the anaesthetic, and then we're helping them to make a decision. Sometimes we don't really get a choice. You know, if you're having brain surgery, most of the time you pretty much have to go to sleep for that. Not all the time. That's another conversation. And then when there is a choice and some options, I'll try and present those to the patients in as fair a way as I can to say, yes, you can go to sleep, or yes, we can do a spinal, or yes, we can do this under an arm block or something. And these are the pros and cons of each technique. And I'm also, before I get to that point, trying to gauge where I have a hunch this patient might want to go.
Everyone's very different, I find, particularly when it comes to doing procedures entirely under a regional anaesthetic, and so that they're awake, and some patients are completely fine with that, and I had someone that almost had a panic attack sort of on the table, which obviously was not a very pleasant experience for them. We navigated it through, and so it's a very hard space to navigate sometimes, having that conversation with people, particularly when sometimes it's not necessarily what they expected kind of coming in.
So but I think where there is a choice, we try and give it to them. Sometimes we just can't give people that choice. There is only one way to do that anaesthetic.
Yes.
Yeah.
Which can be hard sometimes, but ultimately, if it needs to happen, it needs to happen.
That's true. That's true. We want the surgery to happen.
Yes.
All right. Next question.